Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO and co-founder at Elo Health, Ari Tulla. How are you today?
Hey, I'm great. Thank you. Good to be.
I'm excited to have you on. Why don't we dive right into it? I'd love to hear about your background. I know our audience would as well, and then we can talk more about Elo Health.
Cool, wonderful. My name is Ari Tulla. I'm from Finland originally, been living in the Bay Area for the last 15 years. And my background, I come from two things. I was an aspiring athlete. I played hockey my youth, and then I played with computers. And I never became the NHL player my dad hoped, but I became an entrepreneur, and maybe in the end it was the better route for myself. So I was in an early startup already in 99, 2000, building like Web 1.0, think about first websites. And then later in the US, 12 years ago, I decided to end in healthcare after a pretty long stint at Nokia. Nokia is the Finnish, small cell phone company that kind of invented the cell phone, and then later, lost the mojo in the smartphone battle against Apple and Google Android. But yeah, last 12 years, I've been building three companies in healthcare. One, the first one was Better Doctor, focused on helping people find the right doctor. And then we sold that to private equity. And then I took a lead of a company called Quest Analytics, basically building a tools for building doctor networks. So think about your health insurance company or your hospital system, building a network of doctors. So we are kind of the dominant player today in the market. Almost every doctor network is touched by our tools. 200 million people every year use somehow our data when they look for care. And now for the last 2.5 years, I've been working on a company called Elo Health. And the idea here is to bring transparency in the space of nutrition and really make food into medicine, and do that by helping people get the right nutrition at the right time.
And one of these things that people will see when they go to your website and learn more is this. I keep seeing smart protein. Can you tell us what does that mean? And what are you doing in terms of smart protein with Elo Health?
Yeah, that's a really good question. So I need to go back maybe 18 years ago or 17 years ago. I was in Nokia head office, and the guys were hashing out on the wall things. This was the time before the first so-called smartphones came out from Nokia, and they were putting stuff on the wall and ended up calling the devices mobile computers, not smartphones. And I'm almost certain there was a smartphone word on the wall somewhere, but that was not picked. So later now, when we are building Elo, I wanted to focus on what is this category? What are we building? There's really no name for it yet. So we decided to call this whole category smart nutrition. I mean, are we coining the term here? Maybe, kind of. Smart nutrition is kind of like a smartphone or smartwatch or smart car, or many things that we are having in our life today that are getting better. So smart protein, like smart nutrition, it is a product that is personalized to you, made for you, based on your unique biochemistry. Second, it is precise. It is grounded in real science, grounded in the latest advancement we have in human health, for example. And then lastly, it is proactive. What is proactive in this case? Proactive means that it gets better over time. So the dosing gets better, the experience gets better, the taste gets better. So for the smart protein, we are building a custom blend of protein based on your health questionnaire, and also based on the last 30 days of your activities. If you use, like I do, Apple Watch or Whoop or Peloton, all those activities I do are used to design unique protein blend for you. And then if you want to do blood testing on top of it, we can add boosting into the protein. So we can actually add some of the supplements into the protein powder automatically. Think about vitamins, minerals, specific amino acids. I do a lot of long bike rides, so I also have electrolytes in my protein powder automatically. And then what we do, we take the activities to make it proactive, we take your activities, and after every activity you record, you could use Strava or Peloton or Tonal or whatever you use, anything that connects to Apple Health, which is basically any device today, we will notify you after your activity how much protein you need. That's the proactive part. And of course, the preciseness is about, we are trying to understand the latest science, like what does the recovery and the nutrition science talk about performance optimization, muscle building by using the right amino acid blend, for example. So that's what is smart nutrition and smart protein.
I like how it like changes based on the person too, because like I remember years ago, right, you'd go on a website like, what should my protein intake be? You'd fill out the like a couple of questions and they'd be like, okay, you should take this much protein, right? It didn't know what my level of exercise was on a daily basis. So super interesting. And really what you're doing here, which is super exciting, is this whole concept that we're hearing more and more about, right? Food as medicine. You mentioned it when you and I were chatting before, basically helping people to not get sick or not get sick as much as a result of what you're doing. Can you talk more about this concept, this food as medicine, that we keep hearing more about, much more about as a society?
Yeah, I mean, food as medicine is something that Hippocrates, said 2,000 years ago. Well, we don't have his Twitter handle, so we don't know if he really said it or not. But maybe he said it. Let's give him credit on that. But the idea is that today, if you look at the healthcare system today, we spend about 4.5 trillion today in the US on healthcare. Half of that money, or even maybe more, is spent on managing chronic conditions that are lifestyle born. And lifestyle in this case, it means stress and lack of activity and lack of good nutrition and lack of sleep and so forth. So maybe, at least from my perspective, the nutrition is the biggest culprit out of those that is influencing this epidemic of obesity, diabetes, heart disease, and even some cancers. I think we can now attribute pretty directly into our lifestyle. So what can we do? We spend all this money on helping people who are already sick. That's all about the sick care system that many people call it. We don't spend a lot of money in prevention. Today, this year, we spend around 2 to 3% of our dollars in healthcare into preventative care. What is that? It is mainly imaging and testing that we do. Think about mammographies, colonoscopies, think about some vaccination stuff. So very valuable and really needed stuff. But we spend hardly any money on really truly preventing people and educating people on what to do before you get sick. So the whole idea of food as medicine is that if the food is getting you sick, what if you change the nutrition and prevent people getting sick in the first place? What if we could live healthily up to 80 or 90 years old? You have the two things. You have a lifespan and you have a health span. Today, health span is maybe something like 65, 70 years. Lifespan can be 90 years. But the 20 last years or 15 last years suck because you are not living life like you would like to. So the whole idea of what we are trying to do at Elo is to build these systems that are helping people take control, be on a driver's seat for these things, and avoid getting sick in the first place. So the healthcare has this big dilemma where I'm an example. I'm a pretty healthy athlete. I mean, I've been tested every possible way, yet my A1C, my diabetes marker is pretty high. It's been up to high to as 5.8. 5.8 is a pre-diabetic marker for A1C. But I know, because I've been tested for a long time, that even 15 years ago, it was 5.7. So I'm prone to be at a higher level on that specific measurement. And looking at all other indicators, I'm not actually sick. So basically what happened a few years ago when I did the 5.9 marker, my doctor had been seeing my test every year. I do twice a year testing. I was 5.7, 5.7, 5.8, 5.7, whatever. Then I was 5.9, and then suddenly Kaiser Permanente tells me that I'm pre-diabetic, and they're talking about medicating me. I'm like, what's going on? Like, you've been testing me for 15 years, you have all the data, And then suddenly now you make me a diabetic and you are talking about medication. So that's what happens in healthcare. You are creepingly getting sick. And even if you've been tested, nobody tells you that you are getting sicker until you get to the threshold of red or yellow or green, whatever. And then they tell you that you are sick and you are medicated and you are chronically ill for the rest of your life. That's what we try to avoid at Elo, because we do blood testing every 6 months at least. So we see that you get to the yellow, we cannot ring the alarm and say, let's do something about that. Let's change your lifestyle, your nutrition, in order to stay on yellow or get back to green. And then you don't get sick in the first place. So that's, I think, the fundamental problem we have today, that we don't do anything before you are at the threshold. And after that, it's often too late.
Super interesting. It's like hearing. This is why I like doing the videos, Ari, because I get to see how excited and amped up you get when you're talking about what you're doing. So thank you for sharing that. I would like to, if it's okay with you, I'd like to shift focus a little bit to talk about. I know you recently went through a new fundraising. Can you tell us who was involved and really what you want to focus the use of proceeds on that funding round towards as we head into 2023 and beyond?
Yeah, sure. So Elo Health is a pretty new company. We've been around for about 2.5 years. 2022, we raised our seed round of 5 million from 100 CEOs, athletes, and other people. And now this year, we just closed the first institutional funding round where we had bigger investors coming in. We raised $10 million from Octopus Ventures. They are the most active fund in Europe today, investing a lot in healthcare. We had a ReFood VC, a Swedish fairly new fund who is investing in food and nutrition from the perspective of health and environment. They are half $1 billion fund. And then we have Will Ventures. It's a fairly new fund in New York, investing in companies that are using athletes as a lever. So they have a really good roster of different athletes as investors and also partners for the fund. And we really just going to use the money to go from the mode of building the business or building the product into scaling. So we have now pretty good velocity of people signing up every day for the Elo Smart Supplements and also the Elo Smart Protein now. And the idea is to bring maybe 1 or 2 more products out this year. And one of them is super cool. I can't talk about it yet, but we've been building it for about a year already, and it will be very innovative, new type of nutrition product.
Well, I look forward to hearing about that. Maybe we can have you come back on again when you're ready to announce and tell us more about it. It sounds like a lot of exciting things, and thank you so much for what you're doing to create a healthier world. There's a lot of companies in healthcare. It's great to see. You can do both, right? You can create a good business, and you can also help contribute to make a healthier society. What's next that you're really excited about that you can share with us today?
So at Elo, I think we have had we expanded nationwide last year. We crossed a number of people we have been working with that are no longer hundreds but more, and we also are finally expanding to New York actually next week with our protein. New York State has been the only state we have not operated before, because the blood testing is very tightly regulated, uniquely regulated in New York. So at-home blood testing is very difficult to get going because you have to have a lab in New York to do it. So we don't have the supplements, not going to be out in New York yet, but the protein will be out next week. So that's super, super exciting for us. And also I think this point that, having had now hundreds of people go through the Elo program for the supplements, we've been seeing almost 90% of people have a positive impact on the blood biomarkers. And often those are biomarkers that, the doctor is high-fiving them and saying that, what did you do? Great. And these are not happening only because of, the pills we give people, but these are happening because Elo has implemented from the very beginning. We added dietitians and coaches into the mix. So every person who signs up the supplements, they are paired together with Elo dietitian these are registered dietitians that you're going to meet over face to face on Zoom in the beginning, and then every quarter you have a talk at least, and then you can communicate over the app 24/7 if you want. So people often use this to talk about the meals they are eating, talk about products they are having, talk about behavior change they are applying to their life. And having that coach has been a huge impact on people's health. The people who deploy the coach the most have actually had a really significant impact on their health, far beyond what you could do with supplementation. So that has been a really, I think, a valuable lesson for us as a company. And I think for a lot of people that, you have a coach you have a personal trainer, you have maybe you have a mentor, you have had, professors in your past. You need those people to do the right things. I mean, we alone, it's tough to, change behavior. But if you have somebody in your corner who can be listening, can be there to help you, that makes a big difference.
Well, once again, I want to thank you so much for joining me on the podcast here today and sharing your story and telling us more about Elo Health. I can't wait to have you come back on again already, and hopefully we can get you on a panel or something and talk with a group of people. But wish you all the best of luck, and can't wait to continue learning about Elo Health.
Hey, thank you so much.